The American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months of life, then add age-appropriate solid foods, also known as complementary foods, while continuing to breastfeed for at least the first year, if not longer. A growing body of research documents the many benefits of breastfeeding for both the baby and the mother. There are a number of things that childcare providers can do to help mothers continue to breastfeed once they return to work. They should support mothers in their decision to continue breastfeeding and talk about why breastfeeding is good for babies. Tell parents they are happy to care for breastfed babies and are willing to feed them expressed milk. Listen and help mothers to articulate their breastfeeding goals, and provide a quiet place for mothers to nurse their babies. Become knowledgeable about proper breast milk storage and serving methods. Develop a plan in concert with the baby's parents so that the baby can be fed on demand, but whenever possible can be breastfed by the mother. And include fathers and other supportive relatives or partners in decisions related to the baby's care, and encourage them to feel good about the role they play in supporting continued breastfeeding of the baby. Breast milk should be stored in a clean and sanitary glass bottle with a silicone sleeve and a nipple that fits tightly, or in a plastic container, either polypropylene, which is cloudy and a little flexible, or polycarbonate, which is clear and rigid. Both should be sealed to prevent spilling during transport to home or to the center. The bottle or container should be properly labeled with the infant's full name, the date, and the time the milk was expressed. The bottle or container should immediately be stored in the refrigerator upon arrival. It is recommended that breast milk be stored in the refrigerator for no longer than 48 hours, and in the freezer for no longer than 2 weeks. In a childcare setting where feedings must be pre-prepared by the parents and brought ready to be warmed and fed, and where excess milk must be discarded after each feeding, the mother will be able to minimize waste of her milk by adjusting the volume to her baby's appetite and sending extra bottles with small volumes in case the baby is hungrier at some feedings, rather than making all bottles the same size. Leftover servings can then be used the following day. More information about storage guidelines is available by the Academy of Breastfeeding Medicine. Bottles of breast milk should be warmed by using a bottle warmer or placing them under warm running water until it reaches the desired temperature. Bottles should not be left in a pot of hot, and certainly not boiling, water to warm them for more than 5 minutes. Milk should never be heated in the microwave. Excessive heat may destroy beneficial components of the milk. After warming, bottles should be mixed gently, not shaken, and the temperature of the milk tested to prevent hot spots and reduce the risk of burns upon feeding.